First and foremost, everybody, thank you so much for joining today's webinar. My name is James Henderson. I'm the SVP and General Manager for Orion Healthcare for North America. I just wanted to thank you all for taking the time out in your days to join this webinar. This is actually the first of its kind from Orion Healthcare. It's part of our State Health Data Center of Excellence, and I'll explain in just a moment what that is and sort of what we're really envisaging to do as an organization as we move forward for that. Before I dive into a little bit of an overview of Orion, for those who are unfamiliar with our organization, I wanted to talk a bit about some housekeeping for the webinar today. So we do have a lot of people still joining. There is no expectation that those joining need to be on camera. If you want to put yourself on camera so we can all see your faces, then by all means feel free, but there is no expectation to do so. Today's webinar is not going to be a didactic presentation where we're just going to be telling you all what is TEFCA, because I think everybody knows what TEFCA is by now. That's why everybody has joined. We really want to ensure that today's webinar is more of a conversation. It's actually going to be an internal interview from Ken Leonczyk, our SVP of Strategy, with Casey Silverthorn, our US delivery lead. And I'll have both of those folks introduce themselves in a moment. I think the most important thing as well, though, today is, as I said, it's not didactic. We do want it to be somewhat interactive. And by somewhat, I mean we don't have microphones turned on for everybody. But what we do have at the top of screen is a little button that says Q&A. Our ask is that if anybody has any questions as the webinar goes along, please submit your questions through to the Q&A. Those questions won't all be published, but what we'll do throughout the webinar is we'll start to collate those questions and we'll bring them into some thematic areas in case there's similar like questions that come through. We may or may not be able to answer all questions on today's webinar, whether it's due to time or whether it's due to topic, but we certainly want to see if we can address as many of those as possible. And I'll moderate a Q&A towards the end of today's session with Ken and Casey so that we can try to really get through as many of those questions as we possibly can. The other thing that I sort of wanted to reference, we have around 30 minutes, 35 minutes of actual interview time as we go. So we are having a bit of a buffer at the end to allow us to do the Q&A component. So please, as I said, submit any of those questions through on the Q&A and we'll have some time at the end to make sure that we get to as many of those questions as we possibly can. Before we kick off as well, I want to spend just a couple of minutes because I know many of you are existing clients of Orion Healthcare and have a lot of familiarity with us and a long-standing relationship, but many of you are new to Orion Healthcare and may not know us as well. This is certainly not a Orion Healthcare sort of a presentation, and that's also why we sort of don't have some of those presentations in there, but just wanted to spend a very brief moment sharing with those who don't have familiarity with us what our organization is and who we are. And also, whilst I do that, I just wanted to acknowledge what could be a little bit of an elephant in the room for some folks, and that is a public announcement that came out yesterday that Orion Healthcare is in fact going to be acquired by a Canadian-based entity, Healwell. I wanted to address that up front. This is not the forum to sort of go into details specifically on that, but just really wanted to acknowledge that that was something that came out publicly yesterday. If there are questions that come through the chat regarding the acquisition, we won't really address those on today's webinar, but we'll make sure that we get back to the respective folks who ask those questions and address whatever questions we can at this point in time. But I think the most important thing for everyone on the phone is that our Amadeus digital care record solution, which we are most well known for in the United States, is still part of Orion, is still part of this entity, and is something that we're going to continue to invest in heavily within the market throughout all of this process. That leads me to a little bit to who is Orion, what is Orion doing? So Orion Healthcare is a 30-year-old New Zealand-based entity. We've actually been in the HIE business for that full 30 years. We're known as a HIE provider around the globe. We run HIEs across multiple single-payer markets around the world, the UK, Australia, New Zealand. We run the world's largest HIE in Saudi Arabia, but we also have a presence and have had a presence in the United States for 23 years. Orion Healthcare's most well-known product in the United States is Amadeus, our digital care record solution. However, we do have a number of other solutions in the market as well, specifically in the HIE space. As we move forward into today's webinar, as I mentioned, we have Ken Leonczyk, one of our primary presenters, who will be the interviewer for the purpose of today. Ken is an SVP of strategy over here at Orion in the United States, and Casey Silverthorn, who is our US delivery lead. I referenced before our State Health Data Center of Excellence. This is an initiative that Orion really wants to ensure that we are not just giving back to all of you, but ensure that we're actually collecting the smarts and knowledge and best practices from all of you as well to be able to provide this information to this cohort. And so we thank everybody who is an existing member of our Centre of Excellence. We also thank anyone who wants to express interest in participating in our Centre of Excellence. And we hope that this webinar is the start of many webinars across this series from Orion Health, and also part of some of our Centre of Excellence knowledge-based series that will come through in the market. So with all of that, I can see we've got now 27 folks that have joined the line. So thank you, everybody. For those who may have joined a minute or so late, James Henderson, SVP for North America. We do have people on the line at the moment. I was looking at it earlier, from 13 different states across the US. So a great representation from around the US that have registered, in addition to folks from Canada as well. So great representation from the entirety of North America. With all of that said, what I'm going to do is transition over to Ken Leonczyk. He's going to introduce himself more formally, and we'll kick off the formal proceedings for today's presentation. Just a reminder, questions as they come through, please submit them through the Q&A at the top button of the screen. And once you submit them through, we'll review those, collate them, and we'll have them in the Q&A at the end. Ken, over to you.
Thanks so much, James. And we're just so excited to be here to have this conversation with you today about TEFCA and about the landscape of TEFCA, and frankly about how it relates to you. And we're here to be able to answer questions you may have, as well as I'm just thrilled to be joined with by Casey Silverthorn, who's going to be our on the hot seat as I ask these questions and have a conversation with him around TEFCA. I've met a number of you. I've not met all of you. As James told you, I lead up strategy, which includes thought leadership for Orion, and previously was at a large organization called Optum, where I was the thought leader leading up the provider strategy for the corporate entity, and then before that was at the advisory board, and then I go back to DC as a lawyer, as a member of the political side on the Hill. As a chairman's chief counsel, or sorry, senior counsel, and then also at Covington and Burling. So I've been on the law side, I've been on the policy side, I've been on the research side, I've been on the big corporate side. I'm here in a smaller and fantastic entity, always thinking about how do we make healthcare better? How do we make things better for our patients? How do we reduce the frictions in healthcare, and how do we end up making it better, faster, stronger, ensuring that the right information gets to the right people at the right place at the right time. So that's the kind of overarching goal. Casey, I'd love you to introduce yourself, and then we can have this conversation, which is all about hopefully finding a way to make healthcare better.
Thanks, Ken. So Ken, as your lawyer background, go easy on your cross-examination today. But I'm Casey Silverthorn. I'm the director of our delivery teams for the US. I've been with Orion dating back to the 2011 timeframe. And prior to that, worked at a health system doing interoperability work using Rhapsody. So been in the space for quite a while, seen a lot of different standards and approaches come out over the years, and have an opinion on some of these new ones. So.
Fantastic. So let's dive into having a conversation all about TEFCA. You know, James said we're not going to go into the what is TEFCA, but I'm going to take the personal privilege and actually start with the premise of what is TEFCA. Not very too long, but let's just set the stage. Not everyone may be as in deep in this as those of us who have been living it day to day. What is it?
Really, from my standpoint, TEFCA there's two parts to it, right? There's a technical part and there's a governance part. And the technical part, being an interoperability guy, I always look at that's the easy part, right? That's the part that we just do some connections and some new query retrieve mechanisms and some new transaction payloads that come across networks. The governance, to me, is the part that's kind of the elephant in the room, right? These organizations that sign on to a QHIN are required to have flow down language in all of their contracts with all of the different entities they work with. That can be a challenge, right? That can be a challenge to even get some of your small organizations to understand why they need to sign an addendum or sign a participation agreement with this new language in it. So that's a huge challenge, right? And if an HIE signs on to a QHIN, you have to have that language there. And so there's a lot of upfront effort that has to happen prior to an organization signing on to TEFCA and a QHIN.
So help me understand then, just to stay with the basics of where it came from. Like what problem, in general, like I want to know where it came from, the problems that it will solve, and how real you think it is.
Well, right now, I think it's somewhat in the middle ground, right? TEFCA is a real thing. QHINs have been named and the rules of the road have been articulated. I think we're still waiting on some of the technical SOP documentation and how this thing is going to technically function to be finalized. But it is real. The details are still being ironed out, I think. There's a lot of jockeying for position within the QHIN arena. So it's certainly a real thing. I think it probably came out of some of the work that the eHealth Exchange has done for many years, right? This is a national network that connected many organizations to be able to query and retrieve data across the country. And this is, I think, some attempt at a reincarnate or an expansion of that approach by introducing new players into that market.
Why do we need it? I mean,
So,
we've got strong HIEs. What's the problem that was a burning platform that said we've got to have this framework?
Some of it comes back to the federated exchange of data, right? So there's more data types that will be transacted within the TEFCA framework. So it expands on the transactions I think that eHealth Exchange has supported in the past, but it also muddies the waters, right? Bringing in these additional QHINs that are nonprofit, for-profit, like it kind of muddies the waters a little bit by introducing these new players. So what it's going to solve, I think there's going to be some headache, right? We're going to go through this headache with everyone jockeying for position on the different QHINs and which QHIN should they sign up with. Eventually, it's going to enable more data exchange, right? That's the idea behind it. Long term is we'll have more transaction types and a more robust exchange. There's going to be pain, I think, before we get there, right? While people figure out the QHIN scenario and get their TEFCA language, I guess, added to all their participation agreements.
Yeah, I mean, I visited. If you can tell, I have a sore throat and lost my voice a little bit. I'm fighting a throat infection. Visited an urgent care this weekend, and one of the questions that the urgent care asked me as I was registering, do I consent to have my patient information shared to their patient portal? Do I consent to have my patient information shared with an HIE? A couple other questions. Are there going to be opt-ins for QHINs as well? Like, is that one of the problems that we're going to be looking at? How does this all work together?
Well, I think I'm going to reverse that question back at you, Ken. Was it clear when you signed that consent form where your data was going? Right? Like, was it clear that it was being shared on a national network? Was it clear that it was going to which HIE?
And you know what? I work in this business. I know this area. I've been working in healthcare for over 20 years, and the answer is no. And I can tell you what, also, if you don't work in this business, you don't have a clue what these questions are that you're opting in or out of. And I think you could have a lot of people choose to opt out of giving their patient information because they just don't want that government entity that they're afraid of, or that private entity. I mean, there's so much anger at private entities in healthcare right now. They don't want that private entity to have their information. So long-winded answer. I kind of understood it, but no, I can't answer yes to your specific questions. So does this make it easier or harder? Here's my question.
Right. I think that's what we're hoping TEFCA will help solve some of that, right? And it's going to be a while before we get there, right? It's not going to be the magic box that solves all these problems, but it certainly is a step in the right direction, I think, from the technical framework that I've seen up to this point. As well as the governance, right? We need the governance there to be able to exchange this data as well. But so it's a step in the right direction, but it's not without its headache and a lot of work for the entities that are exchanging this information.
I want to say I agree with that. And to those of you who have joined this webinar and don't know, I've written a decent amount on this from a big picture policy strategy perspective. I wouldn't even dare to get into the technical side of it or to the level of knowledge that Casey has. But from my perspective, I do think it's a step in the right direction. Look, Casey, I think a little bit. We've mixed crowd. I may have jumped too deep too quickly. Let's just back up for a second, and I want you to take a moment and just walk me through how this is all supposed to work together. I mean, there may be people, again, you and I talk QHIN day in, day out. There's folks probably Googling QHIN right now. So just take a 10,000 foot view and talk through what that framework is supposed to do, where these QHINs fit, where other entities fit, and help us ensure that we have an equal playing ground for everyone that's on our webinar today.
Yeah. So really, a QHIN is a national exchange hub, right? So anybody that signs up to a QHIN is connected to the national exchange, and in turn, other organizations on other QHINs are now connected to organizations connected on a different QHIN. So it's really a multi-node kind of federated network of exchange. Where it gets interesting, I think, is at the HIE level, right? So you have participants that are signed up to HIEs. HIEs sign up to a QHIN, and therefore those participants are part of a QHIN. But we'll get into this probably later, but if you look at the list of QHINs, there's probably one of them out there pushing their organizations to sign up directly to their QHIN and completely bypass the HIE layer in this. And so you look at it, that's why I mentioned earlier, there's a lot of jockeying for position, I think, within these QHINs and the messaging that they're giving to maybe existing clients or existing facilities. So how it's going to work, Ken, I think is TBD, truly how it's going to work. But we're probably going to see facilities connect directly to a QHIN, and we're going to see facilities get their QHIN connection through their HIE that they're probably already connected to and don't realize they can get that QHIN connection through their HIE.
Yeah, I mean, you alluded to the fact that there is a chance that this can be turned into something that is not led by neutral, primarily not totally nonprofit entities, certainly community-based entities. There's a chance that this can turn into something that doesn't promote interoperability quite as much as we would have hoped. But we're going to hold that as a teaser for those of you, so you stick around. We can get into that in a little bit. I'm going to ask a provocative question, though, since we're in the just origins and conversation around the beginnings of this. We are about to see a change in administration. President Trump is returning to be president. And the folks that he has discussed as the leaders of HHS are a different profile than the former Secretary of HHS, Alex Azar, and Seema Verma, CMS leader. They're different kinds of leaders with different backgrounds. With the decision to have Robert Kennedy Jr. Be put forward to be the Secretary of Health, and then Dr. Oz, CMS. And we've got a Deputy Secretary of Health who has been nominated. That is also, very knowledgeable, but a different profile than what we've seen previously. All to say, what do they think about TEFCA? What's their view of this? Is Elon Musk going to get involved from the government reform side? Like, put on your tea leaves, put on your tea leaves. Don't put on any tea leaves. Pull out your tea leaves and look at them and play Nostradamus. Let me know what you think.
Well, I think the two individuals you mentioned, they're very focused on making America healthier. Right. So if that's the core of their value beliefs, they're going to probably look at this and say, is this going to make America healthier? Right. That's the question that they're going to ask themselves. If they see the value in TEFCA and exchanging of data, and then it's going to go forward. Right. And it's going to go forward immensely. I think what's interesting is one of the names you mentioned in the cost cutting measures. how does that factor in to, some of this overall big picture? I think, Ken, you and I spoke pre-election, and we kind of said, well, we'll see, it could go one of two ways, or, it might not change anything. I think my opinion on that has changed a little bit since post-election, just saying like everything's under the microscope. So we'll see, like, do they believe that TEFCA is providing value and going to make America healthier? If they say yes, I mean, this thing's going full speed ahead, is my belief, right? But we'll see. They have to see the value in it, I think, or they're not going to put any money behind it.
I'm going to give you my projection. I think
Okay.
there are three ways this could go. It could go ahead full steam ahead, where a large for-profit big tech vendor, as it will, is the primary driving force in it. It could go ahead full steam ahead, where the Trump administration uses its force to be pro distributed tech, so that it's not just one organization but multiple tech, which would be a pro HIE side and go full steam ahead. Or it could get caught up into regulatory morass because different stakeholders dislike what they see, particularly different stakeholders leading the government dislike what they see in this for whatever particular reason it is. Now, I realize that's a very lawyer hedge. I just gave three answers, and two were sort of yes and one was sort of no, but that's the best I've got for you right now. All right, look, we've talked about the basics. We talked about operations. Let's talk about some of the people who like it, dislike it, and just to give a roadmap for everyone out there. I want to talk about supporters. I want to talk about detractors. I want to talk about that big for-profit tech corporate entity and interoperability. Then I want to get into HIEs specifically. What's in it for HIEs? What's the play for HIEs? How can HIEs thrive in the world of TEFCA? I want to talk about, and then we'll hit the other stakeholders in the arena, including Orion and opportunities for the future. So if that's okay with you, Casey, that's my game plan for the next bit of our conversation before we open it up to questions. Sound good? Awesome. So here's my question for you. Who are some of the organizations that like TEFCA, and why? And you don't have to give their names if you want. You're on mute right now, just so you know.
I was trying not to blurt out my answer. I think Epic, right? Epic likes TEFCA. Let's just not beat around that bush, right? This is Epic's way to go direct to these facilities and cut out HIEs. I'll be very blunt about that. That's what it feels like when I read the tea leaves, as you said, Ken. So I think Epic certainly likes it. People that don't like it are the organizations that have been doing this work for years, right? eHealth Exchange and Sequoia Project. They have been the neutral third-party trusted national exchange framework, along with Commonwealth and Care Equality. These are the organizations that have formed a really robust national exchange, have been doing so for years, and they're all of a sudden undermined by all of these different entity types, right? And entity types that might have influence with the actual facilities. So it's an interesting time, and all the while, national networks aside and for-profit entities aside, you have the HIEs sitting in the middle saying, what about us, right? Like, quit undermining what we do in the marketplace. So it's interesting times, right? As we watch this all unfold, which with the list of QHINs and who's signing up to what QHIN and what marketing approaches are taken by those QHINs to get people to sign up to them. So it's yeah.
It's fascinating times. The jockeying is really interesting. You gave us the supporters, you gave us the detractors. Let's just dive into this, right? I've been reading a lot about vendors and their role, particularly Epic, in wanting to be and actually becoming a QHIN. Let's just give a fair shake there. What's a benefit of Epic being a QHIN?
My personal belief is that Epic has watched the CMS money flow into the HIE market for years and kind of has their eye on it, right? And as we enter into a lot of the public health use cases coming out of COVID, right, everyone's looking at who's holding the data. And in a lot of cases, it's the HIEs, right? The HIEs have that pop health level data to do syndromic surveillance reporting, any type of ELR discussions, right? the HIEs become gateways for public health. And I think that's an area that Epic's always kind of played into. So they're trying to get some of that money to flow to them, saying, we can do this. We can be the national network, and we can do pop health, and everybody should rely on us. My personal belief again, right? But
And they're big, and they have care everywhere, and they like that was not a term of art. Like they have an ability from a technical standpoint to be able to do this, but they're not the only EMR game in town, right? Particularly, I mentioned her earlier, Seema Verma, who's now the senior vice president of Oracle Health, which has what used to be known as the Cerner EMR. Are they getting into this game?
I think a lot of the Cerner sites are still connected through Commonwealth and through eHealth Exchange, right? So Cerner their exchange was much more open and less. It's probably a bad term. The lawyer and you would probably have a better term, but less monopolistic.
It's a good answer there. So let's talk to about the HIEs then in TEFCA. What are some of the benefits that would come from an HIE operating as a QHIN?
I think if a particular organization is sharing data with an HIE and they get connected to a QHIN through their HIE, they're going to get all these other benefits that an HIE can offer that a lot of folks are overlooking, right? Anything from result routing, the clinical portal longitudinal view, you got pop health analytics. You can even do referrals and referral trends, like where your patients are going. There is so much at a local level that the HIEs can do, right? The HIEs work with these small practices to make sure that they're not forgotten about in this whole game too. But the small practices that might not have Cerner or Epic, what are they going to do about TEFCA, right? How are they going to get connected without a huge financial investment? They're going to have to go through their HIEs of some mechanism, right, to go through their HIE so it doesn't bankrupt them, so they can be on this trusted exchange. So the HIEs and their local touch is going to be key to still providing some of this service and specific healthcare ecosystems. So the HIEs are going to provide way more value than just simply connecting to a QHIN.
And I mean, the local behavioral health provider that's dealing with a Medicaid population certainly is not on Epic and is certainly finding difficulties in being able to share, even with the things that Epic has around interoperability. We all know how difficult it is. I was with a physician last night at not a small, one of the owners of a large, well-known primary care practice medical group. It's actually expanded beyond primary care, and she was complaining about the trying to connect into Epic to get some information. So yeah, that's an absolute benefit and opportunity for the HIEs. Are there going to be HIEs that don't want to or can't operate as QHINs, that want to just kind of do their own thing at a local level? Can they ignore this TEFCA framework? Like, what's your view on that?
I think the instances of that will be far and few between, right? You almost look at, as an HIE, you almost look at TEFCA and QHIN connectivity as a service you offer to your participants, right?
Mm-hmm.
So it's another service that HIE can use to make sure that their participants are well established and the HIE becomes sticky, right? If they left the HIE, they'd have to go find how to connect to another QHIN. So I don't think you'll see a lot of instances of that throughout the country. There might be some. You think about New York and California, where you have a lot of smaller regional HIEs. Maybe they become participants of a statewide HIE, and the statewide HIE is part of a QHIN, right? So you might see different layers there where the HIE is not directly connected to a QHIN, but the instances of an HIE not having any on-ramp to a QHIN whatsoever is probably going to be far and few between. That's just my guess and my opinion on it, but we'll see how it shakes out.
Well,
right?
that's what we're doing. We're playing a little bit of guesses and opinions right now. And your opinion is an educated opinion, as someone with a lot of experience in this business. I can't help myself. I said I was going to do outcomes later, but I'm going to ask you an outcomes opportunities for the future question right now. And this is one where I want you to use your expert opinion. You know, you've been at Orion Health for a long time. You've been in this game for a long time. What should, and I want to give some strategic guidance to people who are on this call with us right now. So if you're an HIE, what should you be doing right now? What should be your first steps to ensure you're in a great position to be able to thrive in this new TEFCA framework?
Well, that's a loaded question, right? There's a lot of stuff you could do as an HIE, and it really depends on the landscape that you're serving, right? Depending on the demands of the state or the region. But I always have looked at public health as like a foundational element of an HIE. So being connected to your different registries at the state, working closely with the state on maybe breaking down some of those silos that exist within public health and better supporting public health and public health onboarding. Right, we saw during COVID, everyone kind of that didn't have a syndromic surveillance registry, I bet they all do now, right? And but if they had an HIE in the state, they could have easily had one pretty quickly had they gone through the effort of implementing it. So I staying close to public health is definitely one thing that I think HIEs need to do and continue to do. And finding new use cases, right? Like stuff, closed loop referral systems. We've seen a few RFPs over the last year for closed loop referral systems and getting really, really integrated into the healthcare ecosystem, right? Not just a longitudinal patient record, but how do you facilitate data transactions from a behavioral health clinic and then bringing the payers in, right? How do you bring the payers into this whole mix as we enter a ramp up, I think, in value-based care?
I think that's an excellent answer to my loaded question. And I think those are definitely no regrets strategies. And I'm going to be so bold and give you my thoughts, and you can tell me what you think. Because I would add to that you should also ensure that you are doing what you do now with absolute excellence. Make sure your
Yes.
workflows are great. Make sure your culture's on board. Make sure your people processes are great. Make sure your technology is doing everything you need it to do, and make sure your technology vendors are actually trusted partners helping you along the way. Make sure you are excellent where you are now. So, because let's just use it. Epic, they're tech, they're big. They're big for a reason. There's a lot of technology that they have that it can be pretty great, and so you want to make sure what you have to offer and particularly from a user experience. If I am a clinician, I want to have a great user experience when I am using and logging into utilizing your HIE. Like that's special sauce, an amazing user experience that gives me access to the public health records, that gives me access to different kinds of data sources with ease, that allows me to view it, and not just like, it's not data, Casey, it's insights. I need to be able to get a quick insight, meaning I need the data that I need and want in front of me right now from a user experience. If an HIE can do this, I'm getting excited if you can't tell. If it's gonna, that is the way I think to be able to ensure that you keep all of the giants at bay, and it's our mission. Like this is what makes our patients and clinicians' lives better. What do you think?
I completely agree, right? You have to have a rock solid foundation in order to build on, right? And so being excellent at what you do today is going to ensure your success as we move through these interesting times, right?
Fantastic. So look, how do you think TEFCA is going to impact the provider organizations out there, hospitals, labs, medical groups, all those folks that are currently, needing to be able to get to the records? And is this impact going to be different depending on what the org is?
We'll see, I guess, a little bit. I know I've said that a few times, but we went through this. A lot of HIEs went through this in the early 2010s, right? When we were signing the data use reciprocal sharing agreement, DURSA, as people onboarded to eHealth Exchange, right? And having that on-ramp to the eHealth Exchange was critical just to give them the ability, right? So a lot of the facilities like a lab or medical group, like you said, they were signing these data use reciprocal sharing agreements at that time. Now, whether they actually ended up using any of the language in those agreements through the HIE or not, we don't really know, right? It's up to the HIE to help enable some of that querying and training on how to get access to the data. But some of this sharing agreements type language, it's obviously different under TEFCA, but they were signed and implemented back in that early 2010 timeframe when a lot of these HIEs signed on to the health exchange. So it's not new, right, for these organizations to sign those types of agreements. I think it's on the HIEs a little bit to make sure that the ability to query these national networks is in the hands of those groups if they're not already.
That makes a lot of sense. So let's turn to the folks that I frankly care the most about, our patients. What's the impact of TEFCA on our patients going to be?
Hopefully, it's better exchange of data, right? You go from one facility to the next, you're not carrying around a 3-ring binder with your medical history in it, right? That's ideal.
So let me pause there. So that's totally ideal, right? But if I'm in one of the states that we have, with us, name one. If I'm in North Dakota, it's where you are right now, right? And I'm going to a facility in Minot, where you are right now, and then I'm up visiting my friend in the city, what, an hour and a half north of y'all? Is that where it is? Is that about right? They're south. Yeah, south. This is like, I'm from North Carolina, y'all. Like, it might as well be Canada. It's south, right? So I'm trying to look at this. I'm trying so hard to be relatable and one of the guys, and I totally blow it. And I go visit them, and I go to an urgent care. We'll make it a hospital, make it more interesting. I go to a hospital, and I'm really not able to communicate well. I had an accident, something traumatic happened, and they log into the HIE. What happens? Are they going to see my records as it is from Minot?
Yeah, so
right
through
now,
NDN,
today.
you would see those records within the state, right? As long as you didn't sign an opt-out form.
If I didn't sign the opt-out,
on your visit,
just assuming assuming I did all that, so they're going to see it. All right, now TEFCA comes along. What's so much better?
I think that other folks can see it outside of the state now, right? And there's a common agreement that allows some of this sharing, regardless of whether you're connected to the eHealth exchange or not, right? I think that's the common thing here is the QHIN that you're onboarded to.
And I'm being a little bit pedantic with this just to make sure we're all on the same page with it. But I think that's actually an important, look, I think all healthcare is local, and HIEs are local, and the opportunity is to own healthcare local. The exception is actually when you are outside of your local area and getting healthcare. Yeah, we need this to be able to work, but I think that's why the play for the HIE to be the QHIN, not the big vendor, or eHealth exchange is acute, right? Like to be able to have this be something that actually it's controlled at a local level, not at the national vendor level. Because from the patient perspective, I'm not sure my experience is going to be all that better. And frankly, I personally believe, and this is just my opinion, patients are going to be less likely to allow their data to be shared if they think it's being controlled by multi-billion-dollar entity versus a mission-driven organization like an HIE.
Right. I think going back to our first example of did you understand your consent form you signed? I mean, that's kind of part of the problem too, isn't it? Like you should have clear-cut consent forms that you're signing at registration. And maybe some of that goes away, right? Maybe it's clear where your data is going, all the places it's going, when you sign that consent form, not just a blanket consent to share.
Sure. And look, I love the idea of national interoperability, national visibility into our healthcare. That's how we make healthcare better. That's how we make it work better in America. But we have to also, like you said, have well-educated, well-informed patients, and we have to make sure that we're getting the patients the info that they need. I think there's a turnaround fair play on this. Like, we've got to make it easier for patients to be able to access their own records, not just for
Yeah.
other people to see things about me. I want to know what's going on, and I think that's I think that can be facilitated through through TEFCA, but I also think that requires visionary HIEs to say we want to find some way to allow there to be a portal, whatever the word is, a front door, you name it, to be able to allow patients to see into their records. Okay, off my soapbox. I'm looking at the time, and I'm going to ask just a few more questions, and then we can open it up to the group. You said what you saw as the biggest opportunities for HIEs in this world of interoperability. Is there anything else you want to add to that before I go to my next question?
No, I think let's keep going here so we have time for Q&A here.
All right, awesome. So how about Orion Health? What's the role of our company, and how can we help HIEs as they are, and other organizations, not just HIEs, state health exchanges, public health entities, Medicaid entities, you name it. How can we help?
Well, I think we work across the entire country and world, frankly, right? So we've seen different models. I know, Ken, we've had interest from some of our Canadian counterparts. How can they do TEFCA, right? So
Yeah.
we've been having these discussions, not just in different states within the US, but in North America and even globally. So, based on those conversations, I think we can help guide best practice, or at least have discussions with folks around what we think might be the best on-ramp or the best way to facilitate QHIN connectivity and TEFCA onboarding.
And how this is to my friends out there listening in, it's always dangerous when you're going to ask a question or you don't kind of have an idea of what the answer is going to be, and it may even be something that you're going to have to start looking up a little bit on acronyms. So I'm going to ask this question. It's a technical question, Casey.
Oh boy.
So that's why this is an interesting one. How is Orion preparing from a technical standpoint to be able to help its clients and future clients thrive in the TEFCA landscape?
Yeah, from a technical standpoint, we need to make sure that our standards, so watching that technical SOP and what comes out of it, we have a baseline framework being connected to a QHIN currently with a lot of our clients in the eHealth Exchange. So we have a baseline already. We're watching this technical SOP saying, okay, now what do we need to add or build on or modify to be fully QHIN compliant with under TEFCA? So it's that's, I guess, from the technical standpoint, Ken, like how are we going to support this? It's really R&D teams keeping an eye on what are the technical requirements over and above what we already do today with the eHealth Exchange and some of those connections. So eye on the prize, I guess.
I actually understood that. That's fantastic. So, along those lines, are you helping HIE current customers, and are you prepared to help HIE, future ones on what developing those new use cases that you mentioned to ensure that they are in pole position as the TEFCA framework develops?
Yeah, I think we're certainly ready to have discussions, right? And that's a lot of what the landscape is doing right now, is discussing TEFCA as we wait for more teeth, right? More teeth to be put in it, requirement to be on a QHIN. So we're ready to have discussions, and what use cases are we going to tackle first?
I love it. And as a strategist, new use cases and deciding where to go is like apple pie for me. I eat it up. I adore it. For those of y'all out there, know that when we get to the Q&A section, if we don't answer your question, Casey and I are available to talk to you one-on-one. We can even bring James in if you want to get the Aussie accent to be a part of it as well. Casey Silverthorn, what's the question that you wish I asked you, but I didn't?
I don't know that I wish you asked a question. I probably need to disclaimer some of my harsh language towards a particular vendor. Right? Like I've always worked with the eHealth Exchange for years, right? And the whole industry has supported eHealth Exchange So I think I'm a little biased just watching the list of QHINs come out and say, what happened to the neutral third party that used to be so critical in facilitating exchange, right? So I'm a little bit biased against Epic, just in the for-profit entity, when we've always thought of HIEs and I would think of QHINs as being that trusted neutral third party. So I'll disclaimer some of my harsh language towards a particular QHIN with that, right? We've always thought of exchange organizations as neutral third parties. So I was a little caught off guard when I saw that name on the list of QHINs. So I just wanted to make that clear for everyone that I'm probably biased in some of those opinions.
Hey, look, just because you're biased doesn't mean you're wrong. And
Yeah.
I think it's fair to say that neutrality, I mean, these are important discussions to have. It's got nothing to do with the quality of a large company like Epic, their EMR, their success. We could talk about amazing things about that organization. What we're talking about now is, where should this patient data live, and in what kind of entity, and who is best placed to serve the needs of our communities, the needs of our patients, and particularly, I would argue, our most disenfranchised and our neediest and our least literate on the medical side of things. And it's like, you got to be really medically literate to understand. So I think that's very fair. What question did do you want to ask me? Which is the one I should have chimed in on?
I'd like to hear your thoughts on on everything, right? Like, where are you at with TEFCA? Do you think it's going to move the needle for the patients? Do you think it's going to move the needle for providers? And do you think it's going to be near term or intermediate term or long term before those parties actually feel the value?
I think it's going to be intermediate term, and I think there's a lot of hurdles that we need to get through. I am optimistic, but I think this is something where HIEs need to dive in and to my advice of the be excellent where you are now, and then make that case and expand your presence and think about what you are doing in order to meet the needs of your patients. Like, all of that makes me optimistic. But anything that comes from a federal regulatory framework, and as a federal regulatory lawyer, when I was at Covington and Burling, when I was on the Hill, like, lived and died on this stuff, ate it up. Like, you always remember, like, think, what the powers of the federal government giveth, the federal government can taketh, and it can get taketh and changed with different leaders around. But here's the thing that I want to say: regardless of framework, regardless of TEFCA, regardless of what we call it, I see this as an amazing opportunity for the incumbent players who are community-based, who are state-based, who are in there with our patients, to take the lead on saying interoperability matters, patient data matters, patients being able to get to their data matters, and we need to be able to share this on the national framework. And everything you talked about from eHealth Exchange, excellent. I think this is a chance for us to move the needle, and to just turn it up a little bit. So I'm thrilled.
Yeah, and we didn't really touch too much on this, but like, starting on my career on the technical side of things and just doing interop. I see Fiona and Callie are on too, so they might shake their heads in agreement. But when the new standards would come out, as an interop person, just working in the IT department at a hospital, you kind of roll your eyes. You're like, I remember when CCDs came out, and they were supposed to be the end all be all to interoperability. You kind of roll your eyes and said, okay, we'll play this game for a while, right? Then CCDAs, and then it was FHIR. And so, like, in some regard, I'm trying to not get too worked up about TEFCA, right? Just because you go through enough cycles of these types of things being released, you kind of just said, okay, we'll wait till it's real, and then we'll do our thing, right? So to some degree, from a technical standpoint, you kind of just say, let me know when it's real. Right.
I agree, but I want to say, like, there's also, like, what you just described is this thing that we have in healthcare of confusing process and outcomes, confusing ends and means, confusing means and goals, whatever you want to say. Like,
right.
The goal is not TEFCA. Who cares? The goal is interoperability and an opportunity for patients to be able to know that their data is being seen nationwide by a clinician in a way that gives the clinician the insights and information they need to be able to give the best care to that patient possible. The goal is to help providers with population health to be able to make their communities healthier, to make them better, to make them well. So I think if we take TEFCA and we just step back and we say, I think there's a lot of opportunity here, this is the chance to focus on our goal, to focus on the ends. We'll be okay. All right, Casey, I have enjoyed this immensely. I want to give some time for a Q&A from the audience. So I'll turn it back over to our esteemed friend, James Henderson.
Excellent. Thank you, Ken. Thank you, Casey. I think that was, incredibly insightful and really good to get each of your opinions and thoughts. And whilst they're representative of some of the things that you both think of, I thought it was very compelling, and you asked some of the hard-hitting questions. Just a reminder for everybody on the phone, there is still the opportunity to submit some questions over the last couple of minutes. There is the Q&A button at the top of screen, so please submit your questions through there. I think you may have addressed this question throughout the presentation already, but who do you both, Ken or Casey, feel are the biggest winners and losers when it comes to TEFCA going forward? And whether we're looking at whether it's the providers, payer entities, patients, vendors, HIEs, who are the big winners and losers?
Casey, you go first.
All right, well, I'll jump in on that. I personally think the near-term biggest winner is going to be the payers, right? So the payers, we've all heard about their HEDIS challenges and getting supplemental data for HEDIS and ECQM data. They need data to help reimbursement. And so I think the payers, honestly, are going to be the first ground level beneficiary of TEFCA. But like we said a lot during this interview, we'll see how it plays out. But that's just kind of reading the tea leaves. I think they're going to get access to that data, use it very quickly, and improve HEDIS scores and move ECQMs. So, Ken?
Yeah, I don't disagree with that at all. I don't disagree with that at all. And I think actually the way I would reframe it is medium term, who's going to be the winner? And that's what really, that's where we need to be looking. And that's where it just depends. I mean, this could go those different ways, but my real hope is that the winner medium term is the patient, because we found a way to keep that local, that information about them local in a flexible, trusted, neutral way, and have it be able to expand over across the country in that trusted and neutral and flexible way as well. So I'm hoping actually medium term after the patients, then it would be the HIEs, eHealth Exchange. Like it would be the system that has been doing this for a while has taken this as an opportunity to do things, to take what we do really well and be even better. And then I'm also hopeful that to be totally honest, I hope there's some vendors out there that are being able to help with the technology to give them what they need, and they're winning because they're giving what's best for the patient. So I hope this is one where the top rises to the top.
Excellent. Thank you both. So a quick question here, and I sort of coupled and mashed a couple of questions together. If you were both a HIE, how would you go about approaching some of your participants that may not have as much familiarity with TEFCA and educate some of your participants?
I'll go first with that, and then I want Casey, you to chime in. But I think this is a great opportunity where it's important that you don't do it alone. I think this is one where you want to get an outside voice and outside help, some strategic help. I'm not saying go pay consultants. I mean, you can, maybe, you do whatever you want, but this is something where you could work with your trusted partners. You could work with, if you're a member of one of the trade groups or nationwide framework. I don't want to give any names, but there are folks you could talk to us. There's folks you could talk to where you can actually get help on your messaging and your language around educating them on what TEFCA is, so that it's not overly complicated, so it's not in the weeds, and that so that you're actually doing it in a way that promotes what you do so well, instead of leaving the door open for a disintermediator vendor or whatnot to come in. Casey, what do you think?
I mean, I agree. You have to have very clear, concise messaging, and that messaging might be different depending on the organization you're talking to, right? If you're talking to a health system versus a behavioral health clinic or a primary care practice, that messaging is going to have to be different and tailored per organization. So I agree with you, Ken. It's just you're almost doing thought leadership on it in some regard, right? You're doing that education with your participants. How you do the education is going to differ based on the facility type you're talking to.
That's it. We have time for one more, James.
Excellent. So I want to ensure that because there's still several questions to get through. There's a follow-up question, actually, Casey, to your comment regarding payers having a benefit with the HEDIS measures with TEFCA. Do you believe the data would be validated via DEV for the ease of use?
Probably not, right? Because in this situation, Orion Health necessarily wouldn't be validating it, right? It's going through this federated national exchange, and the HIE is the conduit that allows the exchange. So the HIE is not holding the data and having a chance to validate it. I think maybe long term, if we get some of the QHINs to maybe enforce some validation within their exchange, it's possible, right? It's possible down the road to make the exchange framework more aligned with a DAV strategy.
So being mindful
I know
of time,
we have
James.
about 1 minute left. I'm not going to address all the questions with respect to Ken's cardigan. So Ken, there was a lot of questions. Where'd you buy your cardigan? It looks fantastic. But we'll park that and we can get back to those who answered that question, asked that question. There is a question as well, though, around do we believe that HIE platforms like the EHR vendors can become QHINs themselves?
So the question was, can an HIE vendor be a QHIN, right?
Correct. Can the HIE itself be a QHIN?
I think yes, in some regards, right? We've seen some of the larger shared service type HIE vendors kind of throw their hat in the ring and trying to be a QHIN. It wouldn't be the worst thing in the world, right? If it was a shared service. Now, Orion Health can't necessarily, because you have to be a U.S. entity in order to be a QHIN. So certainly not in the cards for us in particular, but another vendor, if they had an incentive to do so, yeah, sure, they could be a QHIN. I think you're going to see stuff like maybe CRISP, right? Or Sync Health, where you have a hybrid best of breed organization. They might apply to be a QHIN and bring along an HIE tech vendor into that conversation. I think we're going to see more of that necessarily than people like Orion Health applying for QHIN.
Okay, great. I know we're at time, everybody, so we're actually going to wrap it up there. Thank you to all those who submitted questions. I know we didn't get through to all the questions that came through, but thank you. We'll try to get back to some folks as we do. If anybody does have additional questions, please reach out to any of the Orion Health team. We want to get you back to your days. Thank you, Ken. Thank you, Casey, and thank all of you again for joining. Hopefully, we'll have more webinar series coming out very soon, and hope this was educational and informative for everyone. Thank you.
Take care.